I'm joined today by Dr. Michael Golenhofen, ENT physician from Germany. Our first interview about the root cause of tinnitus has now gotten about 1 million views. Today, we're here to expand on that, and we're going to start first with a quick review of Dr. Golenhofen's clinical research. Dr. Golenhofen, welcome back to the Treble Health podcast. Please share with us what were the main takeaways from your research about subtyping the root cause of tinnitus for your patients coming in your clinic.
Thank you very much for having me, first of all. And as a matter of fact, I investigated a number of my patients and trying to find out what the quantity is of the different disorders causing tinnitus in these patients. And what I could find out that actually 3 disorders are dominating the tinnitus symptom in patients very much. And these are the hearing loss subtype and the central brain subtype and the somatosensory subtype. And from that, I came to the conclusion that tinnitus disorders are very often difficult to treat. But when we do this subtype-specific approach, we're able to help simply because we know what we're treating. And as long as we stay unspecific and symptomatic in our treatment, we can be sure that we will not reach and we will not accomplish what we want to accomplish.
Absolutely. Guys, my name is Dr. Ben Thompson. Very happy to be here with Dr. Golenhofen. I bring the audiologist perspective from Treble Health. Dr. Golen brings the ENT physician perspective from his private practice and tinny care, which we'll get into here today. So the main message that I want to start with, Dr. Golenhofen, is for patients who are listening, most of them have been dealing with tinnitus for either months or years. They're looking for ways to find relief, ways to manage it. I want to start with asking the question, is there hope for patients? Patients who come to you, patients who get evidence-based care, are they getting better? Can tinnitus get better?
Absolutely. Absolutely. And I think it's almost the most terrifying and false at the same time kind of statement to tell people there is nothing you can do. We really know that it is not true. And the most important thing in the first contact of a tinnitus patient and a healthcare provider is that we say, all we need to do is to find out your root cause disorder causing your tinnitus. Sometimes we find 2, sometimes even 3. But when we know what disorders are causing the symptom, then we can know what to do. And this is where we want to get to. And then we simply do what has to be done, and then there is help. It is not always easy to treat those tinnitus disorders. Yes, that's true. But as long as we don't, we can be sure that there will be no help.
Yeah, one of the biggest problems is many people go to a doctor looking for help, and they're told, hey, there's not much you can do, or there's no cure for tinnitus. Sorry, you just have to get used to it. Or sometimes the doctor would say, oh, I have tinnitus too. I just ignore it. And the patient then feels like this professional does not know how to solve my problem, and they don't understand how serious of a problem it is for the individual. So that's definitely part of our shared mission, is to educate patients, but also educate doctors that there are ways to reduce tinnitus. What have you seen in your practice over the past 6 months, let's say even, of patients coming in with significant, serious levels of ringing or hissing in their ears? Are you seeing reductions in the sound? What are you seeing working with your patients in your clinic?
That's a very differentiated kind of question. And we need to know that the tinnitus perception in those different disorders is of different nature. You know, the brain-related subtype, where we start to consciously perceive a sound that is always there, but usually is filtered away, but not in the case when I have this type of tinnitus subtype. Then it is a sound that, as I said before, is some kind of baseline sound in my auditory system. So it will never disappear. The aim is to overhear, to focus away from the conscious perception of this type of sound. And then there is the somatosensory sound, which is of completely different nature, simply because it happens on the level of the human brainstem, where a sound is either present or it is not. So here we need to say we simply want to get rid of the sound. Okay, it's either there, then the disorder is there, or it's absent, then the disorder has gone. And to create more knowledge. And at the same time, it is extremely important to also create this type of knowledge about the different subtypes. I think counseling needs to be subtype specific. If it is not subtype specific, it's not good counseling.
All right, let's get into that. So, one of the most common symptoms for patients who see our nationwide private practice at Treble Health, one of the most common cases would be a patient who has a slowly progressive hearing loss, that they don't experience so many problems with their hearing, but then over a short period of time, weeks or months, they develop significant ringing or hissing in their ears. In that situation, there would be two of the subtypes, two root causes at play. There would be some hearing loss, and then there would be this central nervous system filter, which I simplify and call stress-induced tinnitus. And I want to hear, and in your research, you refer to it as cortical dysrhythmic. So could you explain that common patient journey and what advice you give to them?
Yeah, that's a very important question as well. Simply because here we have two, what I call subtypes at the same time. There is the hearing deficit on one side and the cognitive decline combined with the inner distress level basically being the root cause of the tinnitus perception. And that's why it is important to first treat them both, not leave out one. For example, always use hearing aids in this combination of subtypes because we have a very quick benefit from it. The better the hearing function is, the lower the tinnitus perception will be. And we know from hearing aids that they can support cognitive functions. So that is something we want to do. We won't miss doing. And then there is the distress level and everything that we can do to lower distress levels, which is basically a counseling, psychotherapeutical, consulting kind of process, helping individuals to learn to downregulate their autonomic nervous functions. And when there is, first of all, the knowledge about what to do and the counseling about the importance of treating the hearing disorder as well as the central functions, and then the therapeutic action to use hearing aids, but not to overinterpret their function. Not to say that hearing aid will cure you, but to say, yes, we will use it as an important tool on our healing journey. And then there is understanding, and then this is the right way of treatment.
Yeah. On that cochlear sensory neural hearing loss component, for many of you listening, you probably noticed tinnitus, ringing or hissing. You notice that first, and then you go to an ENT clinic or you go to an audiology clinic, and then you complete a test where we determine what level of hearing do you have and how bad is your hearing, or how much hearing loss do you really have. From there, we can determine what is the best way to treat this hearing loss. And the reason we do that is because tinnitus treatment responds well to treating hearing loss. I think that's an important point to highlight here. Many people would think, no, I'm just trying to solve my tinnitus. But, what I tell many of our patients is when you're trying to solve tinnitus, we often have to come at it from 2 or 3 indirect angles, 2 or 3 indirect pathways. One of them is getting your hearing back up to high performing hearing ability, treating hearing loss. Another might be getting your stress levels, your sleep in order. And then potentially a third would be something like we'll talk about later with jaw or neck conditions. So these indirect pathways, that's actually what gets at tinnitus. We don't have a way to point to tinnitus directly to turn it down. And I think that framing or that understanding can help people realize, oh, I have a tinnitus problem. I'm going to consider hearing loss treatment with hearing aids that are programmed for tinnitus. That's going to help me get relief from tinnitus. That's also going to put my cognition and cognitive health in a good place, because research very strongly supports in the last 5 to 10 years that treating hearing loss is a way to prevent further cognitive decline. Treating hearing loss is a modifiable risk factor to keep your brain healthy as you age. So it's very important. Anything you'd like to add on that front?
Absolutely. That is absolutely accurate. And the more acute the hearing loss is, the more important is the audio stimulation or the measures we take to improve the hearing function. For example, a sudden hearing loss on one ear that is not completely healing over a week or a month. And the individual stays with this kind of hearing loss, sometimes even after acoustic trauma. And then there is a tinnitus sound. So there we will very quickly try to restore the hearing function in a way that we prescribe a hearing aid so that the hearing becomes leveled again and the tinnitus can be reduced. And we know from the cochlear malfunction that a tinnitus sound very often is habituated. Very often we see patients that are even deaf on one ear had a tinnitus perception, and they sit in front of us and tell us, I do not have a tinnitus perception anymore. So we need to know that the plasticity of the brain, of the auditory brain functions, are able to completely habituate a sound, specifically when it is caused through a cochlear dysfunction. And that's why this is so important to combine those two and to counsel patients accurately in their understanding of the different root causes.
Let's talk more about this cortical dysrhythmic response, what we call the stress-induced tinnitus,
Yes.
central nervous system tinnitus. And then we'll go into the neck and the jaw, which those are underdiagnosed significantly in our
Absolutely.
segment. So people listening are wondering, which of these factors do I have in play? In my impression, many people have this sort of central nervous system hypersensitivity to tinnitus. I'd like to hear what you see with patients in your clinic, and then we can talk about the tools that tend to help these patients.
Well, the subtype caused by the cortical dysfunction in the auditory system is the subtype which is most often found. It's more than 45% of our patients, and very often follows another subtype simply because other tinnitus subtypes kind of sensitize the hearing function. Because I have a tinnitus sound mostly on one ear, I'm concerned, and I start to focus very much on my hearing function. So very often the central subtype, which is basically an over-focus on auditory phenomena, follows the other subtype. But then again, it is important to know that yes, it is some kind of learned dysfunction in the auditory brain, and it is as well very important to know that we can retrain, that we can unlearn, so to say, the tinnitus perception. At the same time, also important to say it will always be there, but when you don't hear it over your day, then it doesn't matter for you. It is important to tell and to teach that it is a gradual process of shifting the ratio to what percentage I do hear my tinnitus perception over my day. I'm bothered by it when I hear it 80% or 90%, but I'm fine when it is only 10% or 20%, and I can accept it by saying, it doesn't harm me, it's my reaction, it tells me I'm a little distressed right now, I can do better, I can care for myself, and so on. This is a good counseling that helps to not overinterpret the symptom of tinnitus, but to make it understandable and learn to live with it in a positive way.
And there's interesting research and neuroscience on this too, because part of our brain called the limbic system regulates different stimulus and is trying to protect us and keep me alert to various signals. So some sounds are safe, some sounds are unknown, some sounds are dangerous. And when the brain does not know what tinnitus is, or if it's safe, then the brain is trying to help us, this part of the psychology system. Hey, Ben, there's this sound in your bedroom. You should probably check this out because it might be a snake, a radiator broken, an intruder. So it's that kind of deep brain response that incorrectly categorizes tinnitus. When you say the retraining, that's exactly right, because these are all neurons. These are not set in stone. Tinnitus itself is not set in stone.
Absolutely.
It can move, it can shift. Neuroplasticity allows this to happen. And when we can educate someone on, hey, this is actually what you're dealing with. It's not always easy to fix, but there are real ways to get better. This is what it's not. It's not life-threatening. It's not. It does not mean that you're going deaf. All these things. Suddenly, the system itself just starts to recalibrate. What do you see with your patients?
Absolutely. The moment a tinnitus perception occurs, it's a certain frame that we make up. It's a frame that comes from our biological roots that is telling us when there is a sound you don't know, it might be a threat for you. And so you care about it and you listen to it, and this basically increases tinnitus perception. And then, as you said before, we want to help to reframe in a way that we make understand it's something benign. I don't need to worry about. I can tell, even say, it tries to help me in some way. It tells me I'm a little distressed right now. I need to care better for myself. And when we help to reframe this in a new way, then it's the first and the second step of a healing journey. Uh, it changes so much. The first important step is to tell people there's something you can do about it. It needs a rewiring of your auditory brain function. And then tinnitus is treatable, and then your tinnitus perception is curable. And this makes such a difference when patients can come out of an office and say, oh, now I understand what there's happening with me, and I know what to do. And also make understand that it takes time. To rewire a brain takes time. And I don't want to get impatient on this journey, but to say, I got time. I will rewire my brain function and my auditory functions that now cause a tinnitus perception. But now it will improve and I will get rid of it. I'm okay. And this makes such a difference.
One thing that I see that is challenging is many patients or individuals would try a few things for a week or 10 days, and they would say, it's not working. I don't think I'm that much better. With all these treatments that are available for tinnitus, getting the right hearing aid set up, having potential sound therapy treatment, an ENT physician treatment, the rewiring of the central nervous system and the brain's reaction to tinnitus. Typically, what I see patients who work with us, 3 months is a good time frame to say, hey, I'm going to commit to this. I'm going to be consistent.
Yeah.
And I'm not going to expect too much in the first 4 weeks, 6 weeks. But within 3 months, I should definitely know if this is working or not. What kind of timeline do you give? I know that it varies based on the subtype or the root cause, but yeah. What kind of timeline would you give to someone who is starting a treatment?
That's a very important point. And I must honestly say, I must blame myself for not being aware of that really, because especially as an ENT physician, we're in a very tight schedule in our daily work. And we tend to think when the moment we give good advice, things are set. But this is not correct, not in tinnitus. And I would agree that the 3-month, 4-month period is a very good time span that you can use to help people to transform into a new kind of hearing, so to say, and by that overcoming their tinnitus perception. It does take time. And what is also very important, and which I undervalued very much, even in the last years, that people still need assistance. They want to be assisted in the process. It is not enough just to read a book, just to say once a month, this and that is what you have to do. It is good, it is important to give assistance. Patients with tinnitus perception need someone who just walks along and helps with good advice, with exercises to demonstrate, to help, even to monitor a little bit, to say, come on, stick to the program. Don't be lazy here. It is good for you. Yes, our job to not only give one time, two times advice, or make a diagnosis, for example, in my case, but to be at the side of the patient, of the individual being in this kind of process is an extremely important element.
Yeah. Yeah. The accountability, the consistency, absolutely for the program, the protocol. Patients who work with my team, they respond very well to consistent check-ins, following a protocol, following a system. Focus on this. Just do these things every day. Don't worry about the rest of that. That is very good for our psychology as humans to do that. And for someone going through tinnitus where they're not sleeping that well, they might have anxiety or stress, they're already hanging on to their normal life. It is important to have that. Let's touch quickly on the underdiagnosed part of tinnitus, which is issues related to the jaw or the neck or even dental problems. What do you see with your patients? And is this a problem in our profession that we're missing this diagnosis some of the times?
It's a huge problem that even ENT physicians, other physicians, audiologists are not trained well enough to track and to know about this tinnitus subtype. At the same time, it is not so difficult to find out that we're dealing with a somatosensory subtype. When there is a body-related type of tinnitus, it's really not difficult to find out about it. It's mostly monolateral. It's mostly on one ear, mostly high pitch, almost always very fluctuating, very volatile in its loudness, and it's almost every time very annoying. And I usually say there is no way of habituating a somatosensory sound, a body-related sound, simply because it annoys me so much. And if it's there, it is present, I cannot overhear it. And as easy as it is to find out about it and to diagnose it, as difficult it is to treat it, simply because we need the multidisciplinary approach in making a accurate diagnosis involving dentistry, orthodontic dentistry, orthopedic, traumatology, neurology often. So it is very difficult to find the trigger and then to treat it accordingly and appropriately. This is very difficult, unfortunately.
Absolutely. Well, there is hope for patients like this who have the somatic or somatosensory condition. We've worked collaboratively with some patients. At our practice, we have patients who definitely have this subtype, and they are able to see improvement and get back to living a normal life. So, even despite medical intervention. So, Dr. Golenhofen, I want to ask, what kind of services do you offer at your clinic for a patient with tinnitus? For people listening who are wondering, did my ENT doctor miss something, or what can I actually get? I'd love to hear what you guys offer, and then also share what we offer at Treble Health.
First of all, on the medical side, on my practice website, there is a tinnitus test where I find out very quickly about my subtype. I just answer the questions, and I know what subtype disorder most likely is present in my individual case. This tinnitus test, or subtype test, as I call it, is found on my practice website, which is www.tinnitusclinic in one word with 2C .de. But there is an English version of the tinnitus test, and it is for free. And this is a first important step that I try to offer in order to improve the thinking about the subtype disorders in tinnitus. At the same time, I of course see my patients and do tinnitus checkups where I spend hours in practice finding out the disorder, the root cause disorder. And on the other side, I try to develop and establish a digitalized form of my knowledge, so to say, which is www.tinny-care.com, where there is a little booklet about my subtype-specific approach, which is almost for free. And then there is an online course that I can visit and learn about the different subtypes, including a lot of resources how to treat those disorders best. There's even a retreat which we do twice a year in Sardinia, where we treat 12 patients intensively, and in the course of the next weeks and months there will be an app which will be a program where I counsel patients in Zoom calls so that they have a personal guidance over the period of time that we did talk about, 3 to 4 months, so that there is an intensive assistance in the healing process.
Excellent. Excellent. Well, lots of avenues or pathways for patients to work with you and your knowledge, which I love. One thing that we're working over on our side, so just some context, for the last 4 years, we've been seeing patients remotely over telehealth, and we've seen thousands of patients through treatment, mostly using sound treatment devices on the ears, like hearing aids plus sound therapy. Additionally, working one-on-one with patients, meeting about every 2 weeks over a 4 to 6 month period. And
Right.
that has worked very well for our patients, with a high success rate and compliance of the treatment, getting relief at the beginning, but then improving the condition significantly. An exciting update from our side is that in 2025, starting in July, we're opening physical clinics, physical locations in the United States. So we'll have San Francisco, South Florida, and then in the Northeast regions as well. So we are going from this telehealth online model, and now we're also adding the in-person clinic. Just what I've heard from many patients is that some patients will prefer to be in person for their evaluation. They might want to see a doctor face to face in their clinic, or they might want to actually start a treatment having the technology be programmed in person, face to face. So yeah, that's an exciting update. We've hired some very skilled audiologists to specialize in tinnitus to be working at these clinics. So definitely, yeah, a big update from our side.
Congratulations. This is a wonderful evolvement of your work, I think. And as we said before, you cover two very important aspects. First of all is the hearing aids and the hearing devices, maybe including some noiser function for treating hearing loss on one side and masking a tinnitus perception, though that is not perceived consciously all the time. And then there is the assistance. You assist people over months. They have somebody to talk to. They can have advice on specific issues, and that is absolutely great. It would be wonderful, of course, to also integrate some knowledge about the body-related subtype. And I did place on TinnyCare one online course for tinnitus professionals, so for audiologists and doctors, which focuses specifically on the body-related subtype. And I think it would be wonderful to maybe even cooperate in that point, that you have physical clinics that would cover all three big subtypes, meaning that you can cover up to 90% of patients seeing you.
That's excellent. So I totally agree. In our San Francisco clinic, we have a close relationship with a top TMJ specialist. So they're a dentist who specializes in TMJ, and they work in the same city, and they have some advanced TMJ diagnostic and treatment. So that seems like a very good collaboration of
Excellent.
we need to on our side identify who actually has this subtype, and then have some collaboration with the dental clinic in San Francisco. In South Florida, there's a lot of people who need healthcare in Florida, the South Florida, a lot of people. And right next door to the clinic that we have, like in the same building, there are some dentists and orthodontic specialists. So hopefully we're planning to build that relationship with them, and maybe simply we can educate them on TNJ and tinnitus, because even some dentists don't really know the advanced version of that.
Absolutely.
What have you found for the dental knowledge?
Absolutely. Many dentists are not familiar with the disorders in their own field causing tinnitus perception. And what I would like to focus on, hearing you say that, it's a wonderful idea to cooperate with dentists and TMJ specialists. Wonderful. At the same time, I found that it is extremely important that we do a proper assessment. And when we find out about a tinnitus perception, which is monolateral, high pitch, volatile, started with something happening in the TMJ system or in the neck system, we can be sure that it is a body-related tinnitus subtype. And it is important for them to know from you that you have this idea in mind and you pre-diagnose the patient. And by that, helping dentists to understand when there is no hearing loss, but there is a monolateral tinnitus perception, which is very volatile, what should it be, actually? There is only one disorder that causes this type of tinnitus. And this creates more knowledge beneath dentists, which is something we want to create in the next months and years, I think.
That's excellent. That's excellent. Instead of just saying, go see the dentist, they'll take care of you, it's actually, hey, I wrote this report of what you have. Take this piece of paper to the dentist.
Absolutely.
You'll let them know this is my diagnosis, or my summary of my opinion on what's going on. I want the dentist to rule out a TMJ problem. If there is a TMJ problem, then we can consider a TMJ treatment. Is that how you advise?
Absolutely. Absolutely. We need to talk to each other. The moment we're in this multidisciplinary team, it is important that we cooperate and that we talk to each other actively and try to solve the problems. It is still difficult because the body-related subtype needs a processed treatment. Yes, sometimes you just need to do a dental treatment first, pull a tooth which is inflamed, or do some occlusional work. Yes, it's something more structural. But on the other side, the tinnitus perception itself is created by changes in the motor cortex. And the motor cortex stores movement behaviors and patterns that need to be changed and rewired by treatments that include exercises and a daily exercising over weeks and months. So we need to know it's not enough to just send somebody to the dentist and do some structural work. We need to know the tinnitus perception depends on movement patterns stored in the motor cortex, which are only transformed when the patient is willing to work in form of doing exercises, movements on a daily basis. I like to compare it with playing piano. You want to learn to play piano. You will not learn it by going to a teacher and she plays it for you or he plays it for you. You need to do it yourself, and that's what our patients need to do.
Where can individuals find TinniCare? I have it pulled up here. TINNI-CARE.com, tinny-care.com. Who would be the right fit to check that website out? You get a free copy of your book, or go through a course. who would you recommend to consider going on TN care?
Basically, it's made for the huge number of tinnitus sufferers worldwide. We know that in the US, approximately 10 to 15 million people are suffering severely from tinnitus. In Germany, it is approximately 3 million. But worldwide, we're talking over 100 million people. And basically, this initiative is made for those patients suffering, not finding somebody to talk to. And it's basically a platform that tries to give information almost for free, and then also to give assistance and knowledge for an affordable price. And that's why I try to design it for everybody suffering from tinnitus. And I hope it will be of help.
Guys, check that out, tinny-care.com. And if you'd like to work with Dr. Golenhofen in Germany, Dr. Golenhofen, where do you live in Germany?
My practice is located in the southeast of Germany, between Munich and Salzburg. My patients usually fly into Munich or fly into Salzburg, and then there's just an hour of commute to my practice. And I do counsel patients online on the screen, and I would say in 80% of the cases, it is possible to do this work online by cooperating with physicians in those countries, sending my patients to dentists and to chiropractors or to physiotherapists in order to find best help.
Excellent, excellent. And for anyone who wants to get in touch with Treble Health, we do have new physical locations, which is really exciting. So come support our physical locations. Come stop by for a free consultation, or you can visit our website, treblehealth.com. We have telehealth consultations available for individuals with tinnitus looking for advice from a professional on next steps and getting relief, and hopefully having successful treatment as well. Dr. Golenhofen, you'll be back here on the Treble Health podcast. Thank you again for your appearance, and great to catch up with you.
Thank you very much. And let me finish from my side by saying that I highly appreciate your work. You're one of the very few institutions worldwide that try to incorporate the subtype-specific approach, which makes the difference in becoming and being a absolutely successful tinnitus institution. Thank you for doing your work.
It's our pleasure. Let's keep collaborating. And for anyone listening, definitely connect with us. Don't hesitate. There is help. There is hope. And we're here for you. Thanks, guys. We'll talk to you soon.